infection prevention and control. Please wash your hands. Infection prevention and control.
Let's look at injuries to the pelvic floor muscles. The injuries are, we have overstretching, we have tears and lacerations. Overstretching happens during the last weeks of gestation, where the ligaments soften by the help of the progesterone hormone in preparation for labor. But now, during first stage of labor, we need to know when a woman is bearing down, that is, the pericervical tissue and the transverse cervical ligaments will be subjected to excessive strain. So the uterus is going to sag down and become retroverted. If I can demonstrate to you sagging, this is sagging. When the uterus sags, that means the pelvic floor muscles have got laceration, have got overstretching. The pelvic floor muscles have been overstretched, so they lead the uterus to sag, and in the end, it gets to be retroverted, retroversion. And during second stage of labor, we shall find that when a woman gets overstretching, you shall find a cystocele. Cystocele is prolapse of the bladder. You can find a rectocele, which is prolapse of the rectum. You shall be able to see a woman getting urethrocoele. The urethra also prolapses, and uterocele is herniation of the uterus. So they all get displaced from their usual place and they protrude. So that is a danger that happens after a woman's pelvic floor muscles have been overstretched. When we talk about lacerations and tears, we shall find that when a woman is pushing her baby, the muscles can get badly torn, including the levator and muscles that we have talked about. Remember, those are deep. And when they are torn, you can find that the anal orifice or the anal sphincter are also involved. Now, there are many tears that we know of. We have first-degree tear, which involves the fourchette, the vaginal mucosa, and the skin of the rectum. When we talk about second-degree tear, it involves the fourchette, skin, and muscle. It may involve the deep and superficial pelvic muscles. So, for a midwife can repair a first degree and a second degree tear. But there is also another tear that is third degree. It involves the skin, fourchette, perineum, perineal body, the anal sphincter is also involved. Now, for this tear, a woman is supposed to be repaired from theater. So that means these guys have to do the repair of the third degree tear because the rectum has been involved. Now, learners, how can you know that the rectum is involved? When you insert your two fingers into the rectum, it grips them. For example, if this was the rectum, if I try to enter my two fingers, it is going to grip. The rectum is going to grip the two fingers. But when there is any tear, the fingers are not going to be gripped. They can even find spaces elsewhere. You will find that that is a third degree tear where the rectum has been involved. And when it is involved, make sure you tell those guys to repair the tear. Now, there is what we call a fourth degree tear. Fourth degree tear, we must know that it involves the rectum. It involves, for it to be called fourth degree, it encompasses all the above, meaning the fourchette, the perineum, perineal body, pelvic floor muscles, perineal body, pelvic floor muscles, deep and what? And superficial. Then the rectal lining is also involved. It can lead to pelvic poor dysfunction. The patient will therefore be incontinent of the feces through the vagina so doctor has to be informed if a fourth degree tear happens. That means if a woman gets fourth degree tear, the feces will be seen in the vagina rather than passing through the anal orifice. So the third degree and fourth degree are nearly involving the parts that are similar but fourth degree is severe. The anal orifice is severely damaged or injured. So that is a fourth degree tear. How do we prevent these injuries to the pelvic floor muscles? People, once again, have said the injuries are, we have overstretching, we have tears and lacerations. How do we prevent them? We shall tell the woman to attend antenatal, so good antenatal care is very, very important. The women have to deliver in maternity centers and hospitals rather than from home, from taxis, from elsewhere. We should ask them to use trained health personnel, not traditional birth attendants, if they are not trained. Mothers should be encouraged to attend antenatal. Mothers should be encouraged to go for ultrasound. Ultrasound is going to rule out malpresentations such that a person can be able to plan for the mode of delivery. We have to advise women to have good diet such that they have good proteinous nutrients into their tissues, as we don't want them to tear. So a good diet helps to build up the skin and to build up good muscles. We have to make sure the women take hematinics to correct anemia, and that will lead to tears and lacerations. It can lead to fistulas. We have to educate women on how to maintain good hygiene, because we have to prevent infections. They can feed on blood as well, and then she gets anemia. Yet we are saying if she's anemic, injuries to the pelvic floor muscles are going to be rampant. We have to educate a woman about exercises to strengthen the muscles, like walking and climbing a hill. We have to prevent hookworm by giving the woman antihelminthics like mebendazole. We have to talk to the mothers and tell them or teach them what to do during labor. That is all done at antenatal. We have to avoid them using native medicine because it softens up the muscles so severely, and they can tear. All that is done during antenatal. Now, during labor, we have to teach the mother what to do during labor. Of course, when she gets a contraction, she's supposed to feel the contraction, but as the contraction wears out, she's supposed to pant such that she gets enough oxygen, such that she does not push prematurely. We have to give them pain relievers. Strong contractions can cause tears when she pushes because of pain. She can push and mothers get lacerations. We can do physiological care such that we relieve their pain, but by rubbing their back, and advise them to breathe slowly through the mouth when there is a contraction, and to prevent them from pushing prematurely. During second stage of labor, these mothers should be told to be delivered by a skilled midwife or skilled personnel who can be able to recognize signs of impending tears and prevent them. Advise the mother to push when there is a contraction and to pant when it passes on. They are supposed to be given a timely episiotomy if necessary to prevent the tears. My dears, that is our lesson we have had today about how to prevent perineal tears, and we have known how tears come about. They come about as a woman is pushing, when she pushes prematurely, and we know what causes the tears. If you have any questions, please ask and post them on my email that you already know. Thank you for now. I'm requesting that you subscribe to these videos such that you are able to get more videos.